I'm Teresa Mealy. I'm a family nurse practitioner in Springfield, Missouri. So originally I was in neurology for years and years, probably 15 years. And then for a short time I switched over to family practice, internal medicine for about 4 years, and then started getting into hormones. And I've been doing the hormones exclusively for 5 years. Yeah, so I just had my own issues that I found a provider that was trained by Neil years ago, and then just thought I have to go help people do this exact thing and make more people feel like I am feeling. And so then it just naturally progressed into just exclusively hormones and functional medicine, lifestyle management, nutrition, sleep, stress, those kinds of things we really emphasize in the office. We have a lot of women, usually about 40 and up, and typically they come first, and about 6 weeks later they bring their husbands in. So we have many couples in our office, which just warms my heart. It's great. Yeah, so the women are usually falling apart completely. The men don't really know they need anything. They're just doing what the wife tells them. So when I asked, do you know why you're here? My wife just told me to come in. But if I dig deeper, it's typically fatigue, a little bit of weight gain, less motivation. It's kind of like they wake up, this is the day for the gym. Ooh, I have to go to the gym. Instead of, ooh, this is a gym day, I get to go to the gym. So a little less motivation, more fatigue and weight gain for them. You know, improvement in mood, mainly, sleep. Those are some of the big issues that they come in with. And then from there, things just progress naturally, like weight loss, exercise gets better, then weight improves more and mood improves more because now you're exercising more, making better food choices, libido goes up. All these things really just at a foundational level makes their life much better. Yes, I have lots of patients on statins, for instance, blood pressure medicine, diabetic medicine, antidepressants that are able to get off all of their medicine. If they've been a diabetic for a long time, I have one patient that he's off all his insulin and he was on 2 oral glycemic medicines. Now he's just down to 1. So depending on the duration, maybe we can't get you off all of certain medicines, but I have many patients that have been able to reduce or completely eliminate their other medicines. So nobody leaves an appointment without talking about food and lifestyle choices. My preference is a low-carb, high-healthy fat kind of diet, so we just discuss that a lot. I have a secret Facebook group for my patients where we can discuss it. I have lots of forums on Facebook and other providers on YouTube that I have them follow just so they can get information, but there's not anyone that leaves my office for an appointment. Doesn't matter if you've been seen 10 times or 2 times that we talk about nutrition, because it's that important. You are what you eat. It's not a cliche. I saw a physician that was trained by Neil 5 years ago. I had no idea what I was doing, but I was going to do anything he told me to because I felt so terrible. And then about 6 months into my therapy, I suddenly realized that I'm a completely different person. My life is completely changed in my 40s, and I have to go learn what I was taught. And so I came to Worldlink, and then just want to shout it from the rooftops to whoever will listen now. I think Worldlink is amazing. I think Neil is amazing. He's the world-leading expert in hormones, and I love that everything is evidence-based. I love that no matter who will challenge me, whether it be providers or doctors or husbands of patients, that I have evidence to back stuff up. I would just say, if you're a provider out there wondering should I come to Worldlink conferences, I would say definitely make that commitment. Come, just get to the first conference. You will want to come to the second and the third and the fourth and on and on. You will be back time and time again to refresh yourself. I just think it's very exciting to be able to present different things and different options to your patients that really work, and it makes you just more passionate about what you do and helping people. You will just not regret the decision that you make to come here.